Sir, welcome.
Are you able to hear me, sir?
Yes, we could hear you, and good to see you. And thank you for participating with our students. Armugam sir
pleasure.
will introduce both of you in a few minutes.
Sure, no rush.
Thank you.
Kalpana, shall we start? Okay. Welcome, sir.
Thank you.
Okay, sir. Students, now I welcome our guest and our for this session. Most probably our medicine and paramedicine students are joined here, I think. Dr. Sainath. Okay, Dr. Sainath Gaddam is based on Indian. Now he is in Texas, Dallas. Sir is DT is UG medicine in Osmania Medical College and PG in internal medicine in Staten Island, New York, and then postdoctorate fellowship in preventive cardiology and research fellowship and Warren Alpert Medical School, Brown University, Rhode Island. சார் பேசிக்கலி வந்து கார்டியாலஜிஸ்ட் நினைக்கிறேன், அதில் நிறைய பண்ணியிருக்கிறாங்க. கார்டியாலஜி ஃபெல்லோஷிப் வந்து ஜென்ரல் கார்டியாலஜி ஃபெல்லோஷிப் வந்து ஸ்டாட்டன் ஐலாண்ட் நியூயார்க்ல முடிச்சிருக்காங்க. இன்டர்வென்ஷனல் ஃபெல்லோஷிப் வந்து ஏர்ல் யூனிவர்சிட்டி அண்ட் ஹேவன் மெடிசல் பிரிட்ஜ் போர்ட்ல முடிச்சிருக்கிறாங்க. ஒர்க் எக்ஸ்பீரியன்ஸ் வந்து அவங்க நிறைய ப்ரொஃபைல்ல நிறைய கொடுத்துருக்குறாங்க. ஃபார் எக்ஸாம்பிள் வந்து பிளடபிளியாவில் டெம்பிள் யூனிவர்சிட்டி ஹாஸ்பிட்டல் அண்ட் ஆல்சோ செயின்ட் பீட்டர்ஸ் ஹாஸ்பிட்டல் அல்பேனி இதில் எல்லாமே கொடுத்துருக்குறாங்க. ஒரு 6 ஸ்டேட்டோட லைசன்ஸ் வாங்கியிருக்காங்க. ஃபார் எக்ஸாம்பிள் டெக்சாஸ், நியூயார்க், நியூ ஜெர்சி அண்ட் தென் விர்ஜீனியா, பென்சில்வேனியா, இங்க எல்லாமே அவங்க லைசன்ஸ் வாங்கியிருக்காங்க. சொசைட்டி மெம்பர்ஷிப் பொறுத்தவரை அமெரிக்கன் காலேஜ் ஆஃப் பிசிஷியன்ல ஒரு 6 இதில் வந்து அவங்க மெம்பர்ஷிப் எடுத்துருக்குறாங்க. ஒரு 6 இயர்ஸ்ல வந்து அவங்க கான்சிக்வெண்டா வந்து அவார்ட்ஸ் வாங்கியிருக்கிறாங்க. அவார்ட்ஸ் எல்லாம் ரீட் பண்றதுக்கு எனக்கு டைம் இல்லை. இது வந்து இப்போ லேட்டரா வந்து 23ல மெடிக்கல் சிட்டி ஹெல்த் கேர் ஆல்வேஸ் அவார்டுன்றதை ரீசெண்டாக வாங்கியிருக்கிறாங்க. ப்ரீவியஸாக 2010, 11, 12, 16 அண்ட் 23 இதில் எல்லாமே அவங்க மெடிக்கல் ஃபீல்டில் அவார்ட்ஸ் வாங்கியிருக்கிறாங்க. போர்டு சர்டிஃபிகேஷன் பொறுத்தவரையிலும் ஒரு 8 சர்டிஃபிகேஷன்ஸ் வந்து அமெரிக்கன் போர்டு மெடிசன்லேருந்து வாங்கியிருக்கிறாங்க. புக்ஸ் வந்து சார் வந்து பப்ளிஷ் பண்ணியிருக்கிறாங்க. எனக்கு ரொம்பவே கியூரியாசிட்டியாக இருக்குது அதை ரீட் பண்ணணும். டயபெட்டிஸ் மெலிட்டஸ்ல ஒரு புக்ஸ் அதில் பண்ணியிருக்கிறாங்க. டயபெட்டிக் கீட்டோசிடோசிஸ் அண்ட் தென் ஹைப்பர் கிளைசிமிக் சிண்ட்ரோம், இந்த 3 ஏரியாவிலையுமே அவங்க வந்து புக் பப்ளிஷ் பண்ணியிருக்காங்க. சில சாப்டர்ஸ் இருக்கு. ஒரு 13 பேப்பர்ஸ் வந்து ஜேர்னல்ஸ்ல பப்ளிஷ் பண்ணியிருக்கிறாங்க. அது எல்லாமே கொடுத்தோம்னா லாங் ஹிஸ்டரியா போயிடும். சாரோட செஷனை நாம கன்சியூம் பண்ணது போல ஆயிரும்ன்றதுனால ஒரு கன்சைஸா கொடுத்துருக்கிறேன். சார் வந்து நமக்கு இந்த மெடிக்கல் ஃபீல்டில் இருக்கிற ஜாப் ஆப்பர்ச்சுனிட்டி, மார்க்கெட்டிங் இது எல்லாமே டீட்டெயிலாக கொடுப்பாங்க, நீங்கள் யூட்டிலைஸ் பண்ணிக்கலாம். அந்த செகண்ட் கெஸ்ட் வந்து நமக்கு வந்து கடம் சந்தோஷ் குமார் சார் வந்து இந்தியாவில் இருக்கிறாங்கன்னு நினைக்கிறேன், ஹைதராபாத்ல. சார் வந்து பேசிக்கா அவங்க வந்து என்ஜினியரிங் கிராஜுவேட், அவங்க சிவில் என்ஜினியர், பட் நவ் இஸ் அன் என்டர்பிரனர். அவங்க வந்து 2 கம்பெனியோட ஆப்ரேட்டராக இருக்காங்க. எம்டி, இந்த மெடிஃப்ளெக்ஸோட எம்டியா இருக்காங்க. ஒன்று வந்து விபாசா சொல்யூஷன் இன் இந்தியா, அது வந்து என்விரான்மெண்டல் பேஸ்டு கம்பெனி. அது நிறைய வந்து ரொம்ப இன்ட்ரெஸ்டிங்கா இருக்கு. வேஸ்ட் மேனேஜ்மெண்ட் சொல்யூஷன்ல தான் அவங்க வந்து என்ஹான்ஸ் பண்றாங்க. அது ரொம்ப இன்னைக்கு இருக்கிற வேர்ல்டுல வந்து ரொம்ப எமர்ஜிங் ஃபீல்டு அண்ட் ஆல்சோ ரொம்ப தேவையான ஒன்று. செகண்ட் ஒன் வந்து மெடிஃப்ளெக்ஸ் வந்து மெடிசினல் ஓரியண்டா மெடிஃப்ளெக்ஸ் ரிமோட் சொல்யூஷன், அது யூஎஸ்ல எஸ்டாப்ளிஷ் பண்ணியிருக்கிறாங்க, பட் இந்தியாவில இருந்து ப்ரொமோட் பண்ணிட்டு இருக்கிறாங்க. அதுல வந்து ஒரு 6 ஓவராலாவே 50 ப்ரொஃபஷனல்ஸ் சேர்ந்து வந்து அதை என்ஹான்ஸ் பண்ணிட்டு நல்லாவே சக்சஸ்ஃபுல்லா கொண்டு போயிருக்கிறாங்க. இது ஓரியண்டா இருக்கக்கூடிய ப்ரொஃபஷனல் ஓரியண்டா இருக்கிற ஜாப் ஆப்பர்ச்சுனிட்டி அண்ட் ஆல்சோ மார்க்கெட்டிங்ல இருக்கிற நீட் உள்ளது எல்லாமே நம்ம ஸ்டூடெண்ட்ஸ் எல்லாமே இன்னைக்கு நிறைய சொல்லுவாங்க. உங்களுக்கு மீன்வைல் டவுட்ஸ் இருந்தா நீங்க ரைஸ் பண்ணிட்டு கொஸ்டின் பண்ணுங்க, அதர்வைஸ் மீட் பண்ணிடுங்க. எண்ட் ஆஃப் த செஷன் வந்து Q&A இருக்கும், ஷியூரா நீங்க சார்ட் வந்து கொஸ்டின் பண்ணலாம். ஒன் செகண்ட். அண்ட் ஆல்சோ நம்மளோட ஃபவுண்டர் டாக்டர் ராமகிருஷ்ணன் சார் இருக்காங்க. சார் எப்பவுமே ஆல்வேஸ் வந்துருவாங்க. செஷனுக்கு சாரையும் நம்ம வெல்கம் பண்ணியிருக்கோம், அவங்களும் நம்ம சப்போர்ட்டிவா இருப்பாங்க. வெல்கம் சார், you can proceed now.
Thank you so much, Armugamji. That was the best introduction. Thank you so much. Thank you, Ramakrishnan sir. And good morning, everyone. Sorry, it's good evening for you all, but it's morning here. My name is Dr. Sai. It's good to be here, actually. I'm very happy to be here and try to explain and tell you what opportunities you all have. It looks like I didn't expect this big of a crowd. It's a pretty big crowd. I'll try to see how I can explain what happens in America. So the focus of the topic today is going to be, and I understand you're all in paramedical profession. Some of you would be nurses and other paramedical staff there in India in training. So my goal is for you to understand how healthcare in America works. In India, when you want to see a doctor, you just go, you call the office, you take an appointment, you go, or you go and wait in line, and then when your turn comes up, you just go in and see the doctor. It's not that simple in America. It's pretty little bit of complexity, but it's not that difficult to understand. So if you understand how the American healthcare system works, then you will understand what are the pain points in that system, and wherever there is a pain point, you look for a solution. So eventually, we all know that future jobs are going to go into AI. Artificial intelligence is where it's going to take over. Why is the AI and all these new technologies are coming in? It's to save money. It's to increase the efficiency and decrease the cost of running a company. So I'll try to explain today how American system works, and let's figure this out. Let me show you my slides here. Okay, so give me 1 second there. Okay, so if any of you are going to come to America, maybe if you get a green card, you get a H-1 visa, or you marry to somebody over here, or if your husband has a H-1 visa. So these are what kind of paramedical jobs are there in US? So mostly they're nursing jobs. Nursing course here in America is a 3 years bachelor course, and I'm assuming it's the same thing in India too, where it's a 3-year bachelor course. And you can go on to additional training and can work independently at the level of physicians. Like how in India we have RMP doctors, or they don't go to medical school and they still practice medicine. There is a official way for the nurses to work independently and prescribe medication. So they go for bachelors and then they go and become nurse practitioners. So Indian nurses can also work in America if you take this exam, NCLEX RN exam. And what are the other paramedical jobs here? You can be an emergency medical transport, EMT, we call them as. You can be a medical assistant. You can be a certified nursing assistant, the ultrasound technicians, the radiology technicians. So if you're physically moving to America, then you have a lot of other opportunities. But today's focus is not about the paramedical jobs in USA. Today, the focus is going to be what are the remote jobs that you can do while you're staying in India. So let's try to understand how what happens in American hospitals and the doctor's office. So there is a patient. The patient needs to see a doctor or go to the hospital, and then the doctor or the hospital will bill the insurance company. So the biggest devil here is the insurance company. Insurance company is the main thing that will dictate how the patient cannot just go and see any doctor. The insurance company will decide which doctor he can go to, which hospital he can go to, and then the doctor or the hospital has to bill the insurance company. So patient doesn't pay anything from his pocket. So if this is clear, if anything is not clear during the process, just ask me and I'll respond back. Okay, so let's focus on the doctor's office aspect today. We're not worried about what happens in the hospital. So let's say if a patient wants to come and see a doctor in my office, there is a front receptionist. So there's a front receptionist. When they walk into an office, there is a receptionist there, and after they meet the front receptionist, the medical assistant will come out and take the patient, and then the doctor will examine the patient in the room, and then the patient will go out of the room. Unlike in India, where the patients will walk into the doctor's room, here in America, the doctor has to go to the patient rooms. So there are about 5 or 6 rooms in the office, and in each room there is a patient, and the doctor goes from one room to the other room. After the patient is done, the patient will go to the checkout section of the office, and then the doctor will send a billing code. I'll go through everything, and then the billing is sent over to the insurance company. So this is the process of how a doctor's office works in America. So there is a front receptionist, there is a front office, there are medical assistants, and there is a back office which does the billing. So what is the role of a receptionist? The receptionist is involved in answering the phone calls. So she has to pick up the phone calls, the phone call keeps going on. And then let's say she has to verify insurance. Imagine a patient comes in. So you want to make sure the patient still has the insurance. The insurance could have been expired. Maybe he lost his job. So she has to make sure the insurance is still valid before before he sees the doctor. And the patients have what is called as a copay and deductible. Although they have insurance, there will be some amount of money that they owe the office too. It could be $10 or $20. And that is not fixed. It depends on their insurance. It depends on the kind of insurance they have. So again, all of that is a receptionist role. And this should all happen before they see the doctor, right? Once he sees the doctor and he goes away, you can't call back and ask for the money. So what kind of work can be remotely be done? Answering phone calls. Nowadays, all the phone call answerings have been moved out from America to India. So answering phone calls for the doctor's office can be done remotely. Insurance verification. The patient's insurance can be verified a day or two before. So these kind of work can always be done remotely, and that's what we've been doing to reduce the burden on running the doctor's office here. So prior authorization. So let's say the doctor wants the patient to have a CT scan, an MRI, or a patient might need a surgery or something like that. The doctor wants to do a surgery on, let's say somebody has arthritis and you want to do a knee replacement. So what does the office has to do? The office has to send the notes and communicate with the insurance company saying that, hey, this and this patient needs the surgery. Then the insurance company will authorize saying that, okay, this patient needs the surgery and the patient can go for the surgery. So this is called as prior authorization. Let's say somebody has cough. You want to do a chest x-ray, then you need a prior authorization. You have to call the insurance company and say that, hey, this patient needs an x-ray. Then they'll say, okay, you can go ahead and send an x-ray for the patient. And sometimes for some medicines are very expensive. The doctor, unlike in India, where the doctor writes the medicines, doctor will just write, you want some antibiotic, or sometimes you can go to the pharmacy and you can just buy it like that. But in America, you cannot get any medicine. It has to be prescribed. So the doctor has to send a prescription to the pharmacy. And if that medicine is expensive, the insurance company is not going to cover for that medicine. The insurance will ask for notes. They will ask why this medicine, why not the cheaper medicine. So there is an authorization process that goes. So all of this can be done remotely again. So it doesn't have to be done in America. So this is also being outsourced from America to India. Credentialing. Now we said that insurance is the biggest devil here. So insurance companies, let's say I'm a doctor. There are lots of insurance companies. There is Medicare, that is government sponsored insurance for elderly people. If anybody is more than 65 in America, they get government insurance, Medicare. There are commercial insurances like Blue Cross Blue Shield, United Healthcare, Cigna, Aetna. There are 10 more such insurance companies. So the doctor has to get a credentialing, meaning, I have to go to the insurance company and say that, hey, I want to take care of your patients. Then they will look at my profile, and then you go through some paperwork, and then they'll say, okay, this particular doctor is credentialed, meaning, those patients who have that insurance can come and see me. So that is called as credentialing. So even that paperwork can be done remotely. So I hope you're all understanding the process, right? So insurance credentialing is one aspect of it. Next is, as I said, after we see the patient, you probably have heard of what is billing and coding that keeps, I'm sure if you're looking for remote jobs, the most common jobs you come across in India are billing and coding jobs. So what is billing and coding? I'm a doctor. I see a patient, then I tell the insurance company, pay me for this level of billing. It's not $50. You can't ask an insurance company, pay me $50, pay me $100. It's not that. It's not how it works. You tell how complex your visit was. Let's say the patient was very complex. He had a lot of problems. Then I'll say, and I'm seeing him for the first time. Then I use the code 99204. I send the code to the billing. So there are, as I said, there are 10 different insurance companies. They won't understand the medical jargon. If I tell them that, oh, patient has acute on chronic systolic heart failure, or he has such and such arrhythmia problem, he won't understand it. But when I tell them that it's a 99204, oh, then they understand, okay, this patient is a complex patient and he's billing for a higher level of care. So that is what is billing. So you have a code for the complexity. How complex was the patient? Is it a new patient that you're seeing, or is it a follow-up patient that you're seeing? Are you seeing the patient in the hospital, or are you seeing the patient in the office? So all the codes differ. Let's say if I see a patient in the hospital, like last night, I got a phone call at 1 o'clock in the morning. I can't use the same billing code, the billing code when I see him in the office at 9 o'clock in the morning, right? Since I woke up at 1 o'clock in the morning, I drove to the hospital and I saw the patient, my billing code is going to be different for that. So, and when I tell them that it is complex, they'll ask me, why is it complex? What complex, how many disease problems does a patient have? And when I tell them that patient has hypertension, diabetes, they won't understand that. Again, there are numbers for that. Like I10 means hypertension. E11.9 means patient has diabetes. E78.2 means patient has cholesterol. So there are thousands of codes like this, thousands and thousands of codes for every disease problem. So that's how you send it to the billing team, to the insurance company. You put some numbers and you send it to the patient. So who puts all these codes? The doctor puts the codes in the office. Let's say I do a surgery. Let's say I put the patient to a sleep. When I'm a heart specialist, so I put stents in patients. So when I'm putting the patient to sleep, I use the code 99152. And when I'm doing a cath, when I put a small tube inside their heart and I do the procedure, then I tell the insurance company I did a procedure called as 93452. If I put a stent in, I'll tell them that I did 92928. They won't understand the verbatim. All they'll understand is the numbers. Based on my numbers, they'll have some payment for that number. So if you're going for billing and coding, then this is what you're going to be get trained into, what these codes mean, what is the code for this, what is the code for that. And procedure codes are ultrasounds, CT scans, they all have a different procedure codes. Like if I say 93000 means it means an EKG was done. If you do a CT scan, there's a different code. So everything has a different code. So I hope you're getting an idea of what happens. So when you see courses in India for remote jobs, most times you might see billing and coding courses. I think some of them are bachelors in billing and coding. I know there are 1 or 2 or sometimes even more than 2-year training courses for billing and coding. They're medical transcriptionist jobs. What is a medical transcription? In America, when I'm done with the procedure, I don't want to type it. It takes a lot of time for me to type it. So what I do is I pick up my phone and I dictate it over the phone. I'll say that, hey, this is Dr. Sainath Gaddam dictating cardiac cath procedure on XYZ patient. Date of procedure is 1/25/2025. Reason for procedure is patient had a heart attack. And then I dictate the whole thing. So somebody in India or somewhere else in the world will listen to it and will convert it into a document and then send it back to me, and then I'll sign it and I'll edit it. Sometimes he might not understand what I said, and then he'll leave a gap there. So I'll go in and fill in the gap, and then I sign the paper off. That is a medical transcriptionist job. So those are the regular courses, but what I'm trying you to understand is beyond this also there are a lot of job opportunities. Like as I said, there's insurance credentialing is there. There is a virtual assistant. Like when I'm seeing a patient, I might want somebody to type the notes. They can listen to what I'm saying and then they can type the notes. So those are medical scribes. We call them as scribes. So they just write what we say. So what are the salaries? This is, I don't think you should go with what I'm saying. But these are very lucrative jobs, If you're looking for a billing and coding job, I know that the starting salaries will easily range from 25,000 and above. And in 1 or 2 years, you can easily go up to 60,000 and even up to 1 lakh a month for billing and coding job. Virtual assistants are where you pick up the phone calls from India, you do the insurance verification. The officers here will train you for that, how to do the insurance verification, how to confirm the appointments. Let's say there's an appointment for a patient tomorrow. You just give them a phone call saying that, hey, Mr. John, this is Rakesh calling from so-and-so medical office. You have an appointment tomorrow at 3 in the afternoon. I just want to make sure you're coming in for the appointment. So those are called as virtual assistants. And even they, the salary starts from 30,000 rupees and can go up to 60,000 to a lakh. If any of you is a pharmacist, I know in India, there are not good jobs for pharmacy too. But if you're willing, you can even work for doctor's office from India and you can assist with the refills of medications. There are other things that doctor's offices do, like remote patient monitoring, chronic care management. And easily you can start your salary from 50,000 staying at home, and it can go up based on your expertise. So what is the problem of doing a remote job? The main problem, according to me, is you're going to be working at nights, and finding the right job is also difficult because there are so many companies in India, uh, and you have to understand these contracts are also subcontracted to somebody else. So there's so many mediators in between the jobs. So finding a job is hard, and then finding and negotiating a good salary might also be a problem. What are my suggestions? Since you're all growing up, be confident. Remember that in any job that you do, you're helping someone else by offering your services. Be confident with that. He's not helping you. You're helping him to run his business. So be confident and understand that you're helping somebody. When you do somebody else's job, you're fulfilling somebody else's dream. So be confident. Speak well. Work on your English fluency. You need to have medical knowledge. If you want to work remotely for any kind of doctor's profession, you need to have medical knowledge, because the patients are going to make a phone call, say that I'm calling for a refill on metformin. If you don't understand what metformin means, it's a medication, right? So you won't fit for that job. So it is very helpful for you to be a nurse, and you can still transition out to a remote job like this, and you'll do very well. And my other suggestion is, when you're looking for jobs, approach everyone. If you're making less money in life, it means you're selling yourself for low. Nobody should ever make less money. If you're making less money, you're probably doing something wrong. There are a lot of websites now in this world. You can go on Fever website, you can go on LinkedIn, you can write emails to everyone. From India, sitting down there, you can go onto the maps in Google and you can see all the doctors in Dallas. And there's a way to reach out to every doctor, and you can say that, hey, I want to be a virtual assistant. I want to help your office. And I will take whatever you want. Give me a salary of $1,000 per month. Somebody will respond back. So if you have the knowledge, if you have the work experience, you work for a year or two. If you have the work experience, then you can be your own entrepreneur, and you can start looking for good jobs there. So finally, what I want you to understand is how the process in America works. Unlike in India, where the doctor and the patient relationship is very simple. The patient goes and meets the doctor, and the doctor writes a prescription, and you give the money to the doctor and you go away. But over here, it's more complex because there is an insurance company. You need to talk to the insurance company before the patient sees me. Let's say today one of you is working here. Let's say somebody wants to come and see a cardiologist. They can't come and make a phone call and say, hey, doctor, do you have an appointment? Can I come and see you? It won't work like that. The insurance company has to first authorize, saying that, okay, you can go and see a cardiologist. So it's a little bit more complex, but there's a lot of role for others to help and make this process much more easier. And that's where the remote jobs will help you all to be a part of this process. I'll give the last slide to Santosh. Santosh is
Sure.
Santosh. You
Yeah,
can.
I'll introduce. Yeah, myself Santosh. Hope you all are listening to what Dr. Gaddam Sainath was saying. So our company is called Mediflix Remote Solutions. We work from India itself, so mainly from Hyderabad and other parts of India. So the things which doctor just briefed you, all the things we work from India. So like we say, like all kind of back end support, like medical billing. We have all virtual assistants, and we do prior auths and patient confirmations, remote patient monitoring, medical coding. So we do all kind of services. Our company is established in the last year, so it's a very new company, and we have 2 to 3 clients. For Dr. Gaddam Sainath itself, we are around 15 people are working. So in the way, if we are getting more clients and they are in pipeline. So like that, we'll be having more opportunities. We can multiple with lot of opportunities. So I can see all your guys, all the newly, graduated. So definitely, I'll be in touch with Sir um Armugam sir, and definitely I'll take few students in the coming few months. So we'll try to pitch in few guys. As doctor said, you need to be confident while speaking, and communication skill is the first thing which you all need to have. Good communication skills will land you in a good company. And the second thing is be confident. And all the freshers can get the job. Don't think like we experienced candidates only will get. Freshers also will get the job. We'll try to train him in 1 or 2 months. I say this is not a rocket science or anything. You can just get started within 1 or 2 months. Only thing is you need to be confident after once you get the job, and don't think about the salary and all those things. First 1 year is what you need to just be ready to get trained. After 1 year, you can do anything, and there are a lot of opportunities in India. And like Mediflix, there are hundreds of companies which are working in India. I can say whole out of America has been outsourced to Indian companies. So just imagine the volume of work and the people they are working. And if I post a job requirement in any LinkedIn or in somewhere, I get 50 to 100 resumes. So people are waiting to grab the job opportunities. What I say is grab whatever the opportunity you get and just start with whatever salary they offer. So the stepping stone is very much important. So you can all take my contact details from the slide. You can just share the resumes, or you can, I'll talk with Armugam sir in the coming months, and I'll try to train or try to take few candidates from this organization, from the candidate. Okay, thank you. So if you have any questions or anything, you can just start. You can ask us.
Students, now we can ask questions.
Thank you, both of you. This is Ramakrishnan, Dr. Sir, and Sir, both of you, thank you for joining. You both emphasized one feature that's important for all across all specialties, all student, any specialty they are working, communication skills and confidence. So thankful that you emphasized those two. Students, please work on it. ரொம்ப ஈஸி சொல்லிடலாம். I mean, you need to show your confidence, improve your confidence, and communication skills 100% important. Like both of them emphasized, you have to be confident and show that you are confident to others. Thank you so much.
You're welcome, sir. Yeah, just to reinforce on that, always remember in life, when we are working for others, we are giving our time to them. So we don't have to be weak. You're not, how do I say, confidence. You can always think that, oh, maybe if I learn better English, I'll be confident. Um, Confidence is not that, according to me. And don't worry about your English or anything. People across the world now, the world has become very small. People are able to understand many accents. So you don't have to be so worried about your accent. If you have a good work ethic, I tell even my kids now, If you're willing to work from 7 to 7, nobody can defeat you. You don't have to be scared. If you have a good work ethic, you are willing to work, trust me, you'll all do very, very well in your life. If you're not doing well in life means you're not knocking the doors. You just need to knock the door. The jobs are there. Just knock the door, and I'm sure you all have good working spirit. I see Prasad Baba here. Hi, Prasad.
Yeah, hi. Hi, Sai, hi, Santosh. Thank
Hi,
you
how are
so
you?
much for taking this session, and that too with a short notice. Uh, I know how busy Sai is. Sorry, I'm calling him Sai. I know him since childhood. So Dr. Sai is. But in spite of his busy schedule, he accommodated it to have this session. And congratulations, Santosh, for your new
Right.
entrepreneurial journey. Wishing
Thank
you
you.
all the best. So, students, unmute பண்ணுங்க. நீங்க வந்து questions கேளுங்க. You need to ask questions. Right? இவங்க ரெண்டு பேர் என்ன பண்றாங்கன்னு உங்களுக்கு புரிஞ்சிருக்கும் already. See, Dr. Sai, he is the service provider. He is the doctor, right? He is a cardiologist, and he has 3 medical offices in Dallas right now. Okay. And அவரோட பேஷண்ட்ஸ்க்கெல்லாம் இந்த மெடிக்கல் பில்லிங் பண்றது மிஸ்டர் சந்தோஷ் ஓட கம்பெனி. So this job, this medical coding, Santosh, can you just stay on this slide? I want to ask one question on behalf of students.
Okay.
So it is good that you you be proficient in the medical field, but at the same time, any non-medical students also can take up this job, right? Okay, looks like there is a question. These codes
I think
are standard or variable? Are these codes fixed or standard codes?
no, these are standard codes. I think Dr. Gaddam will say. I think they are trained here, so they are trained as per the American standards. So they are standard
Yeah.
everywhere.
Yes, just to clarify, the codes are very standard. As I said, there is a specific code for every health problem. If you have a cough, there is a problem for that. If you have stomach pain, there is a code for that. Yes, and most codes are, as I said, there are coding and billing is a completely different topic. Do you need to go through the course? Not necessary. You don't have to do that course. That's for a different aspect. Like if, let's say, the hospital, when I go to a hospital and I do a procedure, I'll use, let's say I'm doing a surgery. I use 10 different catheters, 10 different supplies. I'll use scissors, I'll use sutures, I'll use so many stuff, right? The hospital will have insurance billing codes for the insurance company. So the doctor is not going to put those codes. That's where the billing and codes will be required. But in my office, I put the codes. The biller will not put the codes because he doesn't know the patient, and I don't want him to overbill the patient. So if I'm getting the answer right, the codes are standard. Yes. Is this job require specific course? Does this job require specific
Yeah, I will
course?
answer that. I will
Yeah.
answer that. If you see that my last slide, apart from the last two, like medical coding and remote patient monitoring, is what the most experienced persons are required. Apart from that, all the types of services, there in medical background is not required. For medical coding, there is separate specified coding certified training is there, which is available everywhere in Chennai, Hyderabad, all over India. For the remote patient monitoring, you need someone from the medical background who worked in the hospital or some kind of pharma background. So apart from other jobs, medical billing, appointment management, eligibility verification, you don't need a medical background. But precisely, you after during the course of your training, you will understand the terminologies. So the people who are working with me, only one or two are from the pharma or medical background. Balance, who are working, they are all from the engineering or some degree or BCom graduates.
Kavya and Navnita Krishnan. Did your question get answered?
Yes, sir.
Okay. I have a follow-up question on that standard codes. So now the codes are standard for US, right? What about other countries, UK, Canada, and all? Are the codes different?
Definitely different.
Different.
Completely different. Yeah.
Okay. Okay. So then people need to be aware of the codes for country specific.
Yeah.
Right. Okay. Okay. Yeah.
Uh,
Let's see the next question.
There is
Go
one
ahead.
other question actually. I just want to talk to that. Somebody is a BSc cardiology, BSc in cardiac technology graduate working as an echo technician in a multi-specialty hospital. The question is, if I study any certificate course on medical coding, can I work as a medical coder? Yes, dear, you
Yes.
can work as a medical coder, but you're already doing a BSc. You want to go for again coding course for 1 to 2 years. I don't think, I mean, how many years you want to read? How many times you're going to change your profession? You're already doing a good thing. Either you work as a eco technician and you'll make enough money, or if you don't want to do that, then start in any of those remote offices. You don't need to. Remember, guys, education is overrated. Why is it important? When you finished your BSc, you're telling me that you went to school from morning till evening. You're a good student. You can be trusted. That's what college tells me. If somebody goes to college, it tells me that okay, he can go from 9 to 5, he can sit in one place, he can work, he can read through the exams, he can pass, he's reliable. What you learn in college and what you practice in real life might be different. So you don't have to go for 100 different courses every time. Because there is a lot of full-time courses. So don't waste your time shifting fields and learning. Try to get a job and learn it on the go if you can. Somebody is a B Farm student. Can I get a job in Mediflix with this qualification, a master qualification? If you're a B pharmacist student, Mr. Mohan Raj, you have more than enough qualifications. You're all overqualified. These jobs in America, those girls who work in the front desk, they're all high school students. They don't have B pharmacy. You're overqualified for these jobs. So be confident and approach all the medical doctors' offices, and you should be able to find a job. Right, Santosh? What do you have to say?
Yeah, definitely. You can try to get this job. Means master. What his question is like, do we require master qualification? Definitely not
No,
required. Yeah, B Farm itself is enough. So we'll try to get in touch.
But
somebody's
again,
saying
again,
studying.
Mohan Raj, the intent Dr. Sai is telling is you can make much more money as a in the B Farm industry job itself than in the medical coding,
Yes, you're right.
right?
You're
And
already
then
overqualified.
yeah, and you have a better career path in the pharmaceutical industry than in the medical coding. See, again, students, let me clarify that this medical student, I mean, sorry, this medical coding job is kind of a stagnant. There cannot be much growth in that,
Yes,
right? So
yes,
you started doing this medical coding job. After 10 years also, you'll be doing the same medical coding job,
yes.
Exactly.
right?
I know about this. One of my cousin, they are working in Hyderabad. So from the past 10 years probably he might got some increment or some position, but he's there, whatever he is doing, same coding.
Correct.
So the no new learning will be there.
No, yeah, no,
But
no, no.
Prasabha, sorry to interrupt, but he's rightful in asking one thing because B pharmacy, the problem with Indian pharmacy is they don't have good jobs. Most times they're going to they're marketing these medicines and they go to doctors' offices.
Mm.
Even there, they don't grow up, and it's also a long path to succeed. So they give you very little money, and you're waiting outside the doctor's offices. You should explore other work opportunities. I mean, you have the knowledge, you go and work and see if remote job is something that you want to do. But don't, it's not just billing and coding, there's more than that. Because, as I said, you can be a virtual assistant, you can be a remote pharmacist. Uh, there is one pharmacist in my office, she works remotely. What she does is she refills the patient's medication. Let's say every day we get at least 30, 40 patient refills. So what is that refill means? One patient will say, I am finished with the medicine, metoprolol or something. So refill is click. If I click a button, it will go. But it's not that easy. I have to make a phone call to the patient because the patient might have seen 3 other doctors in the last 3 months. Somebody might have changed the dosing. So how does this remote pharmacist help me? She gives a phone call to the patient. She looks at my last note and sees if that's the dose that I suggested, and then she'll give a phone call to the patient and make sure nobody has changed it, and then we'll send the prescription over to the pharmacy. So for that, I need somebody who is a pharmacist who understands how much of insulin to be taken. And there are remote patient monitoring. Like some patients, we give them blood pressure machine, or they have sugar. When they check their sugar, it comes to our system straight. When they check their blood pressure, it comes to into the office portal. If the blood pressure is high or blood pressure is low, the pharmacist who is working for us will give them a call and saying that, hey, your blood pressure is too high today. Did you take your medications? If it is, and if the patient says yes, then she will call me saying that, hey, this patient's blood pressure is 180. Should we increase the doses? So there are a lot of ways you can help the doctor's office. You don't really need to go into billing and coding, is my thing.
If for example, if you see, the latest question, Dussa, I'm studying third year BSc Physics. I think he's a physician assistant. So he might be having knowledge of what doctor, give prescribed medicine and everything. So he can work as a scribe, medical scribe. So he might be useful for the remote patient monitoring kind of job.
But again, you all have to understand what Mr. Prasad has been stating, guys. For remote jobs, there are certain problems too. You may get a better salary to begin with, but you have to understand you're going to be working at nights. So balance that, whether you want to be working in the daytime and what is the growth in your career path. And but I can say that, I mean, what is your take, Prasad? I don't know what is the main issue here. A lot of kids, one is a physician assistant, one is in nursing, they're optometrist. Why are they looking for remote jobs?
Yeah, so I think they're looking for remote job. They don't want to go out of their city, their hometown.
Got it.
Yeah, that is the. Yeah, go ahead. Somebody's talking. Yeah.
Good morning, sir. Sir, myself, I'm Deluka Heavensia. I'm currently studying a cardiac perfusion technology. So, what kind of career opportunities can I get in America as a perfusionist? Should I have to do masters, or should I get any 2 years training, and can I join a job in America?
Dear, cardiac perfusionists have very good salaries here in America. But the question is, how are you going to come to America?
Sir, after completing my studies, I was willing to come to America, but I don't know how to come. I'm asking a guidance, like what should I do?
So let me answer.
Give me an email. I'll look into it. But maybe let's see what Prasad has to say.
So Deluka,
yes, sir.
see, the thing is, the number one problem what you are going to have is, right, getting a work visa. Okay, so that is called H-1B visa. Okay, you must have seen all the latest news after Trump came. So usually H-1B visa is given for IT professionals, and now they started giving for other professions like finance, accounting, like that, those fields, and doctors also. But these are all like paramedical courses. Still, it is not very clear who is going to provide you that document. In the H1B visa is employer, right? The company has to sponsor. It is not that, okay, Prasad or Diluga or Sai, okay, I have money, I will give money, I will go apply the visa with the US consulate and get the H1B visa. No, the employer has to sponsor. So what happens is, at this point of time, I really doubt any American employers are going to sponsor the paramedical courses, H1B. If you are here already for some reason, basically, like again, you say, for example, let me just give, I have seen a lot of people, right? Say like family-based green card, right? If their parents or some family member is a US citizen, right? They can sponsor you, then you can come here. Once you come here, you have some kind of authorization to work. Then maybe getting this job will be a different path, right? Then we can see like what is your qualification, experience, and all. But the number one problem will be for you is to how to get into this country and get the visa.
If I want to
Okay,
add, sir,
sir.
the third option is like she can come for the education.
Yeah, she can come.
Like
I
for
mean,
higher
Very
studies.
expensive.
yeah, higher
Higher
studies, correct. Masters, you have to come here and do MS and then change job. Then again, after that also, we have to see in that field which employer is going to give the sponsor the H1B, right? Because she is going to study only in the medical field or any allied courses.
Okay, sir. Thank you.
Yeah, it's going to be challenging, Diluga. Mm, uh, coming in that profession directly for work.
And
Okay, sir.
cardiac perfusionists are very few in America. That the job is not. It's a very good job. It's a very highly paid job, but you don't need so many of them either. It's not like you need 10 perfusionists in a hospital. There is only one or two perfusionists in major hospitals here. So to answer your question, you can keep looking, and if there is anybody who will sponsor H1, but as Dr. Prasad was saying, Mr. Prasad was saying, it's very hard. It's very hard. Maybe if you come to America, maybe if your husband or if you're on a H1/4 visa, you can probably definitely look for those jobs. Yeah.
Yeah, that is
Okay, sir.
that is the easiest, Diluga. I know it sounds ridiculous. Marry somebody who is already working here. Okay, come here as a dependent visa H4, then you can start working.
Sir, if
After
someone is there in America, like relatives or someone is taking me sponsor, can I work there?
No, they have to sponsor you a family-based green card.
Okay.
Okay, so at this point of time, like Sai was telling, the easiest and best method is marry a boy who is working in America. That's it. Then your life will be settled. You can do whatever you want once you come here. Okay, all the best. Satya, okay, Sai, you have answered that question. So basically, third year operation theater and anesthesia. Okay. What is the next?
Prasad, I mean, a lot of people are actually into varied fields. It's so impressive to see that they're in so many areas of different paramedical professions.
Yeah,
Guys, you all have to understand one thing. You all have very good resumes. Go knock the doors. Go to smaller hospitals. Don't undersell yourself. Go and work in Indian environment. If you don't think you're getting enough pay, obviously money should be a motivation for us, right? Then look for remote jobs, but first learn your own field good. Don't look for learn your field, whatever you're doing. If you're into if you're working on operation theater, if you're doing an ultrasound technician course, if you're into BSc nursing, dedicate yourself, work hard, learn that, and then go and work in that field. If you are not happy, then look for remote jobs, because as I said, the problem with any of these remote jobs are you're going to be working at nights. So it will be very hard. Now you're young, you can work for 10 years at night. But after 10 years, after 20, after 30, you're going to have family, you're going to have kids. So look into those aspects too. So,
yeah, it's an interesting question. Whether we should write TOEFL exam. Okay, Santosh, you have responded. That's good. You don't need TOEFL. TOEFL is only to do MS. If you are coming here to US to study MS. Yeah, that is good. Again, students, you have plenty of opportunities in your respective paramedical courses itself. I mean, this is also one of the other opportunities. Just remember that, right?
yes.
And whatever it is, one thing is common is you have to come out of your hometown. You have to migrate to bigger cities to be successful in your career, right?
Here
You
I want
cannot
to Middle East has more opportunities for this field in Middle East countries.
Yeah,
And
yeah,
high paying actually.
right. So Diluga, you were asking, right? So now Santosh has given a tip. Instead of US, maybe you can go to Middle East countries.
It's true.
They are
Right.
really highly paid. Actually,
Yes,
there
sir.
are so many of them. They got very much settled. Bahrain is a country. They are looking so many opportunities for this kind of students who are having medical background, paramedic.
Right. So, Santosh, on those Middle East countries, right, do they look for any practical experience, like minimum years, or the freshers
Yeah,
can they apply?
freshers, okay, probably they might not take at least 1 or 2 years experience might be
Mm.
very good. And I see most of the interviews they have been taken in Chennai, particularly from Chennai.
Mm. Okay.
Them,
Okay. So, students, again, you
because
need
they can
1 or 2
explore.
experience in your field.
Exactly.
Yeah.
Even Singapore also has a lot of opportunities.
Mm.
Yeah. So, okay. So one thing I want to say is thank you all. You all are very young stream here. If if I came to US and if Dr. Prasad has come to US, I'll tell you one common thing. I'll tell you for people who are all are doing okay in their life. If you think, you want to become like us, the trick, it's nothing else. Anybody can be anywhere. You be confident, be medically fit, be physically fit, wake up 4 in the morning, go for a run, go to your college, learn your course well, knock the door, guys. Okay. There are tons of jobs. You'll all do extremely well. You have more qualifications than 80% of this world. So you're already in the top 20% cream by having your bachelor's that you're doing. You're already in the top 10 to 20% in the world. 80% of them you can help. So don't have lack of confidence. You have more credentials. Knock the door. In this world, you can just email anybody. If they have a job, they'll approach you. If they have a job, so don't forget to knock the door. You can go to Google. You can go to a particular town and you can look for somebody's an optometrist. Maybe talk to him and see. Maybe there may be some opportunity in his ophthalmology office that he can remotely shift it out. So aim good, work hard, and I hope Dr. Prasad will guide you all well.
Yeah. Sai, there is an interesting question.
Mm-hmm.
Any chance AI will replace medical coding?
Yes, AI is definitely going to be, AI will even replace me. That is happening because AI is so smart. We all have to adapt to it. Is it good? It's 100% good for the world, right? AI, let's say, why do we say this particular doctor has good hand in India? We keep hearing that this doctor is better, that doctor is not better because of the understanding of the knowledge, right? But AI, there are hundreds of journals that come out every week. I cannot update myself with all of that, but an AI can update itself based on all the articles that are being published. So obviously, AI has more knowledge and it will equalize everybody. Like I see a lot of patients, let's say, I know that anybody with diabetes should be on a cholesterol medication, but a lot of doctors don't prescribe it. But if AI takes over, AI will make sure everybody is on the same medicine. So are there downsides to it? Yes. But obviously, remember, whenever technology comes in, certain section of the population are always going to be worried, saying that, oh, they're not going to be better. But you cannot stop technology. Technology is here to come and it will make lives better. Uh, I don't know how many of you know Dr. Prasad created an AI back when he was in his teenage years for Indian Railways, right, Prasad Babu? Saying about ticket reservations. So
yeah, I think mixed. Yes, I did a project on AI 89, and I did another different software for Indian Railways. Yeah,
Indian
I did
Railways.
both. Yeah.
So did that help? Absolutely, it helped. So will it replace? That's not the right word. There is always going to be
Manual.
we will transition into something else when AI cannot work without us, right? So I think it's the best thing as AI will take over the world. You guys will be more needed because you're much more smarter. So your jobs are not going to go. So don't be worried.
So basically, new jobs will get created. Okay.
Yes.
The current job might go. The new jobs, new skills will be born. So we have to learn those new skills to update ourselves. Right?
Yeah.
Simple example, let me tell you. right? Industrialization, mechanization happened in 1960s and 70s. All the manufacturing sector, like we have all these automated machines, right? So all the labor force, there were so many people throughout the world lost jobs, but there were new jobs created, there were new skills emerged, and people have migrated or upgraded to those new skills, right? So now this AI is going to be of that kind, right? So I have one question. Santosh, here you have like what is it? Certified coding specialists. So is
Yes.
there any certificate or certification done or required for that?
For medical coding, especially, it is required. There are coaching centers where they train and then they make them write exam. The exam cost is somewhere around 30,000 to 40,000.
Okay.
So it is little expensive. But once they are certified, they get job anywhere in India, even in Arab countries also they can get.
Okay. Okay.
That is a very good opportunity, but there are a lot of people they are trying that. That is why I can see a lot of questions on medical coding, because we can see a lot of job opportunities on medical coding, particularly because most of the US companies, that insurance companies, they outsource to India. So there are thousands of guys who are doing this coding, and they're trying to get the job in this field. But certification is must for the job.
Okay. Okay. Thank
They
you.
need at least 6 months of the time. They need to go and they need to read all the codes, and they need to memorize it, and they need to write exam.
Okay. Thank you. Thank you, Santosh. The students, any other questions? You can please unmute and then ask. It's not that you have to type only in the chat box.
So I think it's about time.
Yeah.
I'll leave with one thing. So thank you again so much for having us. It's been a pleasure. And if anytime you want me to do it again, I'll be more than happy.
Yeah, definitely, Sai. We will do more sessions to SEEEDS. And again, first of all, thank you very much for accepting my request immediately the moment we came to you for this session. Thank you so much. And to Santosh also. Thank you, Santosh. Sorry, I couldn't talk to you directly, but
No problem.
Thanks for coming and then explaining to our students. We will definitely be in touch with you, Santosh. As you see, right, so many students are here. Like
they want to work remotely.
New students into our stream. So far, we are accepting like around 100 students per annum across different fields. 15 to 20 students are in paramedical courses alone.
Okay, sure.
So thank you so much again.
Thank you.
Be in touch, and we'll have a going forward. Thank you so much.
Thank you. Bye.
Thank you, everyone.
Bye.
Okay.
Thank you, sir.